Well, when people look up things online, quite often they might get correct information. It's just that it's not personalised for themselves. So they'll just get lots and lots of information. So, every side effect of a drug, or, every headache can be a brain tumour, which is not technically incorrect, but it just doesn't really help them relate to what they're experiencing. Well, people can receive misinformation about any health condition, but people tend to go looking for answers and looking for information when it's something that perhaps their doctor can't give them a definite cure or treatment for. So chronic conditions, and perhaps even some of the more scary and dangerous things. So people will tend to go look for a cure for cancer or a cure for a condition that perhaps Western medicine can't do. Well, the internet's been great in one way because it does give people access to a lot of information, but people need to be able to be guided through it, to know how to filter that information. And certainly as a GP, I've seen people either come in with a predetermined diagnosis, they think they know what they've got or they want a test, or they even bring in printouts of things they've printed out and ask you, have you seen this and what do you think of this? So it's challenging for doctors sometimes to handle that sort of behaviour. Well, misinformation can come from anywhere, whether it's from the internet or from family, friends, anywhere. Where it's potentially, I guess where I notice it most is where people think that it is a credible site or a credible source. So, and a lot of sites and a lot of groups that have particular health agendas sometimes develop websites that sound like they're credible. And it is really hard for the general population and for people without that intimate health knowledge to work out what's real and what's not. Well, misinformation can be dangerous in any way. Importantly, if people delay diagnosis because they self-treat because they think they've diagnosed themselves for something, and that can be dangerous just by the delay. But the really dangerous things from my perspective tend to be when people are told to do something instead of what their doctor told them. So people can get information about trying some alternative therapies or some complementary things which may work and may help with their condition, but they shouldn't be stopping their usual treatment.